Suprabhadam. Good morning to all. Dr. Padmanabhan here. See, last time I did a video in Malayalam on muscular diseases. Muscular diseases. Muscular means neuromuscular. Muscular always goes with neuromuscular. Neurology also. So there was a few people who said that they have medical terminology in which they couldn't understand. I guess it will be very, very far and few in between, because I make an effort to translate or transliterate most of the medical terminology into whichever language I speak. See, this is because of a slight lack of, can I say that? Lack of effort from the listener. It's very easy. See, these are a few words which you have to learn, that's all. And if you have doubt, you can always ask me. I'm willing to give a glossary of medical terms if it's needed at the end of it in the comment section. But it may not be needed most of the time. For example, today I am going to talk about muscular problems in the elderly people. So muscular also entails some neurology also, not the whole neurology, but the neurology related to the muscles. But most of neurology has a lot of connection with muscles. So muscle is called myo in medical language. Myo, M-Y-O, myo. So the muscle pigment, there is a pigment in blood. There is muscle is red. Pigment is called myoglobin. Globin is a protein. Myo is a pigment made of iron and some other thing also maybe. Iron and something else is there. So anyway, the muscle pigment is called myoglobin. Like that, the disease in muscle is called myopathy. Padi means disease. Padi. Like say homeopathy. Homeopathy means, but that's not a disease. That's a system of medicine. But padi means pathology, disease, pathology. You know, all of you know about pathology. Pathology means that is what disease there is in the body or in the part of the body is pathology. So myopathy. So myopathy, all muscle diseases are myopathies. But there are this is some by conventional or by semantic convention. See, sometimes we say myopathy to congenital muscle disorders. Congenital means when one is born. Congenital. Most of these congenital diseases are hereditary. Hereditary means transmitted from older generation to newer generation. So hereditary. And hereditary part is the genetic. So these are genetic disorders. Myopathy are genetic or DNA. Genetics through DNA, RNA, all those things. But there is something called the microsome also. Microsome is a small body in the cell which produces protein, but that can also produce some muscle disease. So microsomal myopathy is also there. But these are not that common. Microsomal myopathy. So that's myopathy. Then another term is itis. Again, itis means any itis anywhere means there is inflammation. Inflammation means there is some this active pathology going on. See, pathology, when it is active, it produces heat. So that's why inflammation. So that is called myositis. There are 3 myositis in this particular lecture. One is called polymyositis. Again, poly means many. We always say polytechnic. Polytechnic means they teach many other of the the techniques, many utilitarian things, technique, that's polytechnique. So like that, polymyositis. Then there is another myositis called dermatomyositis. Dermato just means skin, dermatology, skin. So dermatomyositis, it's called so because the myositis is also associated with a skin condition or a skin pigmentation, particularly a skin pigment, that's called so dermatomyositis. And there is a last one in that myositis. Actually, it's a degenerative disease. But by the way, degenerative means degeneration, regeneration. Something is degenerative means it is deteriorating. It is going down. So when you're growing old, you always have degenerative disease because all the faculties, all the organs in the body will degenerate when one becomes old. So that is called inclusion body myositis. Inclusion means there is something inside the muscle, and what is inside the muscle? That is the degenerated proteins, like you have degenerative disease, like so for example, degenerative disease of memory is called Alzheimer's. They have got a particular protein is there, or they are otherwise called prions. Sometimes prions also, it's a kind of protein. Prion is a kind of protein. So myeloid it's protein derivative. Myeloid, it's called myeloid also there. So these will take up some colors. Produce myeloid will take up eosin is red color, like that. So this is all about the this one medical terminology. It's not a rocket science or anything. Another common thing which we say is, but that's how only you can say. So instead of infant, back we always say, because most of these things were first written in Latin, Greek, in Western medicine. Of course, in India it's all written in Sanskrit. But so infant we say anterior, and anterior, and the back is called posterior, and the side is always called lateral. And the side is lateral towards that side. Towards the middle it's called medial, because it goes to the medial. That's all medical terminology. Anyway, and so in this part of this series, I'll be talking about the diseases of the muscle, myopathy, myositis. Then there is something neuromuscular junction disorder is called. It's called myasthenia. Myasthenia. So myasthenia just means muscle asthenia, muscle weakness. Asthenia means weakness. Somebody asthenic means he is weak. Myasthenia. So that's what I'm going to talk about. So this myopathy, myasthenia, most common cause is there. This is a congenital, I said. Myopathy is generally congenital or genetic. It's inherited. But there is various types of inheritance there. That's beyond what I am talking just now. But just in passing, I'll say that there is something called sporadic. There is something called dominant. There's something called recessive. There's something called autosomal. There's something called sex-linked. Like that. That is a chromosomal thing. So one has to have some idea of that. Then you can say this genetic. What kind of genetics? Then you can ask what kind of genetics. First of all, just read a little bit. Read the net. You'll get. So that's about it. And so I said the muscle. When you talk about myopathy, there is no muscle disorder without they are very related. This is the nervous disease, because all muscles are moved by the what's called motor nerves. Motor means movement. Motor vehicle, moving vehicle. Motor. So they are supplied by motor nerves. These nerves always come from where? Spinal cord, isn't it? So and they are controlled from brain. So there are certain tracks. They are called tracks or ways or some wiring which comes to the brain, comes to the spinal cord. There are neurons in the spinal cord, neuronal nerve cells in the spinal cord. From the neuron, the neuron has a long limb coming out, or a long, what can you say, fascicle coming out of its body. It's called axon. So, motor nerve means, motor neuron means this nerve cell and its axon, which will go and hook up with the muscle cells or myocytes. So it's all always related. The movement of the moving muscle is always related to nervous tissue. It can't be separated. So, but in passing, I'll also talk about what's called a polyneuropathy. So my neurology is not about muscle only. It's about what's called a regulation of this one. Glands, which is done by, it's called autonomic nervous system, because it does not come in our volition or in our knowledge. That's why it's called autonomic. It's automatic. You can say automatically done things. Autonomic nervous system is there. Then there is something called sensory nervous system. Sensory means the sensation, which deals with sensation, and motor means which deals with movement. So the neurology here is either mononeuritis or mononeuritis means single way tract, like sensory neuropathy. Again, neuropathy, neuro plus pathy, disease of the nerve or the structures of the nervous system. It's called neuropathy. So mononeuropathy means it affects only one part of the system, like sensory neuropathy, motor neuropathy, autonomic neuropathy, or polyneuropathy. All these things together is called polyneuropathy. I'm not going to talk about it's not possible to finish, in one talk you cannot finish, but just touching on all these things, get a basic idea, and probably help some doctors who are dealing with old people. This is basically for old people. I won't be going into the details of other disease like myopathy. Myopathy basically affects, this congenital disease starts from the young age, and many of them die before they reach middle age or old age. So it's not such a big problem in old age. So I won't be talking about the myopathy in detail. See, myopathy itself is divided into dystrophy. It's a pathological term. Dystrophy means the muscle structure of the muscle is damaged by pathology. That's called dystrophy, muscular dystrophy. That's a common myopathy, which is inherited or genetic. And then there is something called myotonia. Myotonia means the tone of the muscle. If the muscle contracts, then it keeps its tone. If the muscle in your body is not keeping its tone, you'll be all limp and you won't be able to stand up. So there's always a tone in the muscles. So, but in myotonia, what happens is the tone increases. So it is always in a semi-contracted state. That's a disease. So semi-contracted state. So the person is not able to move. He has difficulty. Sometimes the muscle will start wasting, and along with myotonia they will have other system diseases also, like conduction abnormalities in the heart, and also these are also diseases, inherited diseases, but that can go on to middle ages, sometimes old age also. But this muscular dystrophy in old age is not may not be that common, because by the time it becomes 60 years, 70 years, many of them will expire. So that's the story of the muscle. And coming into some detail, then most of the muscular myopathies affect our truncal. The truncal means connected to the spinal cord muscle, the truncal muscle, or it's otherwise called proximal. That's another medical term. Proximal means near the middle. Proximal muscles. Proximal, for example, is the shoulder muscle, proximal muscle, and the thigh muscle. They are proximal muscles. So the weakness In myopathy, generally affects the proximal muscle. Then there's another feature in myopathy. It's called symmetry. Symmetry means symmetry. Means measuring on both sides similar. That means it affects both sides equally. Symmetry. If it is not affecting equally, it's called, how do you say, anonymous. They say you add just a to it, so it becomes asymmetry. Asymmetry means there is no symmetry. Asymmetrical muscle involvement means some muscles are there in the proximal group, some are in the distal forearm or hand muscles are also involved. So asymmetry. Because these are diagnostic importance. Asymmetric muscle myopathy or muscle disease means if it is purely motor, just affecting the muscle without sensory, asymmetric, then it is called a motor neuron disease. That's a particular disease, asymmetric disease, motor neuron disease, which is again, it's not I can't say it's congenital, but usually from childhood, it is a defect in glutamate, some glutamate, and the treatment is basically give anti-glutamate in the early stages. After that, there is no, it won't be effective. You have to have just keep him by supportive, keep him alive by supportive treatment, because along with proximal muscle also involves muscles of the respiratory system. So we breathe through the because of the aid of a muscle called diaphragm, which separates the thorax from the abdomen. Diaphragm inside diaphragm. So diaphragm, we breathe through it. When the diaphragm contracts, what will it do? It will inspire or expire. We will inspire actually. When expiration is a passive process. So anyway, it's not important. But it affects the diaphragm, so people won't be able to breathe, and many of them die in respiratory failure. Then muscle also involves the part of the muscle which is also motor nerve, a motor muscle, or swallowing. They won't be able to swallow. They won't be able to take it inside. It's called a deglutition. Deglutition means take nutrition inside the body. Deglutition. So deglutition will be affected, and this one swallowing will be affected, and so that will they will have to be given artificial feeding, either through a tube or make a hole into the stomach. So in family history, then you can ask, do you have somebody like this in your family who was suffering like this, or who died of respiratory failure, or who died of a heart, because myotonia, I said, sometimes affects the heart. So heart disease, who died at a young age, heart disease. So these are the things which in history and examination, what you can see. Then then they will have contractures also, but contractures are more common in people having disease like neuropathic disease. Disease affecting the nervous system. Contracture means the muscle will be in a contracted or like a stiff state, so the joint will be deformed, contracted state. That is muscle contracture. It's called a contracture, muscle contracture. So if the muscle of this forearm is contracted here, contracture like this, hand will be like this. Some deformity. You must have seen people like walking like that. Different parts of the legs, different parts of the hands, contraction, and the knee joint can be acquired also. If you keep the knee joint for a long time like that, in a contracted state, flexed like this, it will be difficult to extend it. So muscle, so it's called contracture. Contraction for a long time. Contraction for a long time will lead to contracture, muscle contractures. So this is how you make a diagnosis, but diagnosis is not that easy. Then to separate from the myopathy from neuropathy, you have to do some electrophysiological studies. One study is, by the way, I have done all this in the Malayalam version of this. They just, I will say, in some detail. So, there are two types of electrophysiological study in muscle nerves. One is called nerve conduction study, NCS. Other one is called needle electromyography. They put a needle in the muscle, see it's twitching. Normally, the muscle, there won't be any electrical activity in the muscle. If there is an electrical activity in the muscle, that means the muscle is denervated. The nerve is not acting on it. So you can measure that. In some cases, you can actually put a small electrical current through this needle and study its response. That is EMG, electromyography, or NEMG, needle electromyography. The another thing is nerve conduction study. Again, nerve conduction study, what you do is put a small, the same hertz. Hertz means the energy measurement, no? Hertz, megahertz of maybe 3 mega, 2 hertz, I don't know. You put small electrical current into the nerve and see its propagation, or if it makes a waveform. If it is not propagating, means there is no conduction. That means the commonest conduction abnormality you are studying the wire of the wiry part of the nerve. So I said this axon, it comes on the cell body. So it is called axonopathy. The common demyelinating, there is covering to the axon. It's called a fatty covering, myelin sheath. That is gone. That is an acquired, or it's a treatable condition, generally immunological. So you can make conduction, drastic reduction in conduction means axonopathy, or axonopathy. So these are the electrophysiological studies. Then as far as muscle, if you want to make a definite diagnosis, why I said definite diagnosis, these are quite rare in old people. But old people also have an innate decrease in the power of muscles because of age-related changes in muscle. Age-related changes. Our motor units, I said, motor nerve, the axon and the muscle. That motor unit, 70% will be lost by 8 years in old people. But that's not equal to sarcopenia. You can say it's part of the sarcopenia. But that's not a sarcopenia is one other thing. It's kind of inflammation, fat, fat infiltration, all those things. So, but this is lost in old people. So, generally old people have some weakness. Generally, they have what's called a weakness of the hip flexors. So they won't be able to climb up stairs and things like that after 8 years. But otherwise, if they were like this, and all of a sudden they develop something, means they developed a myositis. And once it was considered very rare, but now they say what I said, inclusion body myositis. Initial I said inclusion body means there is some degenerative change in the muscle, to which our own antibodies go and attack. It produces myopathy. That is inclusion body myositis, inflammation because of that. That's common in old age. So if somebody was having some difficulty walking, but then he gets laid up, he's not able to walk at all, and his problem is probably you have to rule out inclusion body myositis. For that, the only way is you do electromyography and all of maybe controversial muscle. You take the muscle and study it. And muscle studying, muscle labs are it's not a cakewalk. It's not that easy. For to study muscle, you need a lot of things like what's called immunohistochemistry. So antibodies are used, then some special dyes are used to study the structure of the muscle and where exactly the damage is, and sometimes electron microscopy also. So send to a laboratory where all these equipments are there. That's where you can study the muscle, not otherwise. Send to specialized centers for probably The nearest center is Nimhans in Bangalore. So take the muscle, send to Bangalore. So that is about this muscle. Then there is, this can be, see, in old people, I said myopathy is there, myositis is there, all these things are there, which is more common. I said inclusion body myositis may not be that uncommon. Then the motor neuron disease is there, but before you consider motor neuron disease, always consider what's called, when you have what's called a condition called spondylosis. Spondyle means spine. Medical term for spondyle is spine. So spondylosis means something wrong with our spine. I mean a bony spine. So because inside the bony spine there is a canal, spinal canal, and through which the nerve, the neural tracts or the wiring of the brain comes down to the spine or goes through that. So that will be affected by the changes in the bone. Now, as you grow old, I've done a video on osteoarthritis. So like that, age-related changes will produce. It's called spondylosis. It mainly affects the neck part and the lumbar part. Lumbar means just behind here, just above your buttocks. Where you always say low back ache. That is a lumbar area. So lumbar spine, I think, can produce neuropathy as well as myopathy like picture. So always rule out that one by taking MRI and doing the nerve conduction studies and all those things. And particularly the lumbar canal stenosis is quite common when you become old because of the spondylosis. Cervical spondylosis is also common. Cervical means all upper limbs, lower limbs, everything, even trunk is affected. It can even affect the diaphragm. So diaphragm, yes, it can affect the diaphragm also, because the diaphragm is C4, that the cervical 4. So if you have, but more common cervical spondylosis, the lower cervical segments. Upper cervical segments affect means it can affect the diaphragm. So it's very difficult to differentiate from all these things. Myopathy, myasthenia, but you have to do investigations for that. If you are in doubt, always take a muscle biopsy. Muscle biopsy is the definite thing. And nerve conduction study, these are not that difficult. So your nerve conduction study, electromyography you should do always. But nowadays people are, our level of knowledge is in undergraduate knowledge, level of knowledge is actually the same thing is taught to postgraduates, but it is so vast, so you are not able to focus. That's the problem. Actually, even an MBBS doctor can do electrical nerve conduction study, but you should have some focus on that or special interest in that. Then you can do all these things. So like old people, generally under GP, so you do all these things for all people. So and send a biopsy if possible. Biopsy is always taken from this shoulder muscle, this muscle here, and the muscle quadriceps here, thigh muscle or the shoulder muscle. Shoulder muscle is called deltoid, but that I am not talking about because other common people are watching this. So, so that's how it is done, and I will have to make another video to finish this. But I just go through another thing, two or three things which I left in the Malayalam part, especially the steroid myopathy I left. In old people who take steroid or who have autoimmune disease, you are giving steroids. For some other reason, you are giving steroid for a long time, they can develop what's called steroid myopathy. It's all proximal myopathies. Proximal myopathies affects the limb girdle muscles, and sometimes it can have features of denervation, things like that. Very difficult to differentiate from other things. You may have to do a muscle study again to differentiate. But generally respond to slow withdrawal of steroids by giving some other anti-immunity drug like azathioprine or methotrexate or something instead of steroid. There is another thing, the drug induced, again, Drug-induced most common drug is we come across statin, but the most common is not statin. The most common drug-induced myopathy and neuropathy is caused by alcohol. Hmm? And they can have different types of myopathy. Proximal myopathy, distal myopathy, they can have polyneuropathy, they can have painful motor neuropathy. All these things are possible in alcohol. So always rule out alcohol. And another thing is endocrine like thyroid. Always rule out thyroid problem. Both hyperthyroidism, both will produce myopathy, myositis, whatever. So always do this test. And then the last in passing, I say that the myasthenia gravis affects the neuromuscular junction, and especially it has got antibodies against the receptor there, acetylcholine receptor. So some people are positive to it, they have got positive. Some about 30% are negative to antibody, but still they will have the same neuromuscular problem, myasthenia gravis, and the treatment even they will respond to acetylcholine. I mean, acetylcholine means you give pyridostigmine. Generally, you give pyridostigmine, and I think these are the things, the old people having walking difficulty, eating difficulty, and all that, maybe sometimes suffering from these rare diseases. Like motor neuron disease happens 3 in 1 lakh, not million. I think last video I said million, not 1 million, 1 lakh per lakh, 4 lakh, or 1 per lakh. But myasthenia gravis is more common. It will be maybe about 6 per 10,000. So these are not that rare. Then again, myopathy, all those things may not be rare, may be rare. But still, these are the differential diagnosis. You have to consider all these things. Thank you. Thank you very much. Thank you very much.